Good evening, everyone. Thank you for joining us for the next half hour or so. My name is Bill Ennis. I'm one of the associate directors with BC Hockey. And one of the jobs that I do is organizing webinars of this nature. The whole Enhanced Services project came out of the annual meeting this past year, where we simply asked the question of local associations, how could we make you and your people better at what they do? And this was one of the ideas that came forward, that we could gather a group of professional people knowledgeable about topics that we need more information on, and we could share that with everyone. Not only that, we could bring everyone up to speed with sort of the state of the union in BC and across Canada. So in saying that, that's the whole idea behind the webinar services. Welcome to the Concussion Awareness Toolkit. And with that, I'll turn it over to Brianna.
Alrighty, so like Bill said, for those that just joined, I will be putting everybody on mute just so that we can hear the presenter properly. So we have Dr. Shalina Baboul on the line with us. She's been with the BC Injury Research and Prevention Unit for the past 16 years and is involved in various injury prevention strategies and initiatives. Dr. Shalina will spend the next 30 to 45 minutes talking about the Concussion Awareness Training Toolkit, otherwise known as CAT, and she'll just spend some time going through that program with.
Good evening, everyone, and thank you for calling in to hear about concussions, which I'm coining an invisible epidemic, and the real need to standardize care and practice in our province and throughout Canada. So what I'm going to talk to you a bit about background on where we've come, give you some really key take-home points, and talk about what we've developed to try and reduce this injury amongst children and youth. So the reality is, children and youth are being hurt. They're participating in stunts such as this with no protective equipment whatsoever. They're participating, another clip I had which wasn't playing was an individual trying to jump the length of a swimming pool and basically landing right at the edge on the other end with his legs like a scissor and suffered an incredible groin tear. So they're participating in all these kinds of activities. We see it all the time. But what we want is that to give children and youth the tools to navigate the wisdoms and be safe, be preventative. A lot of times, you know, we hear, I'm the best skier, snowboarder, player, but it's not necessarily yourself that you have to be aware of as well. It's the person around you. You know, you could be skiing downhill, and the skier next to you can catch an edge on their ski and come barreling into you. So what we want to do is really give individuals the key tools to prevention and have them use the wisdom to navigate the risks accordingly. So concussions have been around for a very long time, and the old adage was, you know, you've had your bell rung and you just played through it. I myself played competitive soccer for 25 years and as a goalkeeper and can count the number of concussions I've had and how many times my coach said, you're fine, don't worry about it. But if I'd known then what I know now and the harm I could have potentially caused myself, you know, I certainly would not have continued to play. But it wasn't until around 2009 with the death of Natasha Richardson, I don't know if many of you are aware, but she was an actress married to actor Liam Neeson. She was taking a beginner ski lesson back at Mont Tremblant back east. She wasn't wearing a helmet and took a seamlessly harmless fall. She got up, she said, I'm not kind of feeling okay. She skied back to her chalet, and a couple of hours later, she started suffering intense headaches, was medevac to hospital, and died from a subdural hematoma. I have no doubt that Natasha Richardson would be alive today should she have been wearing a helmet. And then so that piqued a bit of interest and attention, and it kind of petered off. But it wasn't until 2010, the Winter Olympics, arguably the world's best hockey player scores the winning goal in the Olympics, is now sidelined from a concussion. That's when people started taking note and saying, okay, what is this thing? What is this thing called concussion? And it really piqued interest in media and medicine and has continued since then. And since then, you've heard of numerous others, such as Michael Schumacher's incident, Hillary Clinton's concussion, which gave rise to the concussion summit held by President Obama at the White House last year. And you hear about it now on a daily basis pretty much. But what is really imperative is that how a concussion is handled in the minutes, hours, and days after injury can significantly influence the extent of damage and recovery from this injury. If you sustain a concussion, if a player sustains a concussion and it's not recognized and they continue to play, they are now 3 times more likely to sustain a second concussion and potentially more severe with a longer-term recovery process. Now, again, if that's not recognized, you are now 9 times more likely to sustain significant brain damage and possibly even death. So in Sidney Crosby's case, he sustained a hit to the head that wasn't recognized, that he potentially could have a concussion. He was playing in the Outdoor Winter Classic. He continued to play and played 2 days later in a regular NHL season game, took a second hit, and that second hit is what sidelined him indefinitely at that time, which resulted in about 11 months of not being able to play the sport. So it's really imperative that we recognize the potential of children and youth who could potentially have suffered a concussion. But if anything, some of the really key take-home messages I'd like to hone in on is that a concussion is a brain injury, and a lot of people don't recognize that. I've had parents say to me at hockey, I just thought it was a knock to the skull. Well, it is a knock to the skull, but it's actually what's happening behind the skull to the brain. It's the movement and the bouncing around the brain inside the skull. It's a complex pathophysiologic process induced by traumatic forces to the head or other part of the body, resulting in the movement of the brain inside the skull. It's not a structural change that occurs during a concussion, unless you've got a skull fracture or a bleed to the brain. It's a functional change that occurs and a chemical imbalance. The misnomer, which we often hear about, and we're hearing it from physicians themselves, is that you have to lose consciousness to sustain a concussion, and that is not the case. That only happens in less than 10% of diagnosed concussions. So it's really important to note that. Typically on imaging, CT scans or X-rays, they'll appear normal. Again, unless there's a skull fracture or a bleed to the brain, because it's a functional change to the brain, you won't see anything on neuroimaging. And symptoms this is another really valuable take-home message from this, is that a lot of times a player will potentially have taken a hit. They'll come off, the coach or the trainer will ask them a couple of questions, they have no signs or symptoms, and they put them back in the game. And that's not necessarily the right thing to do, because signs and symptoms can subtly appear up to 2 days later. So we always suggest to err on the side of caution and keep that individual away from playing the sport for a couple of days. And I always say, would you like to be out of the game for 2 days, or would you like to be out of the game for 2 years? So always err on the side of caution. And signs and symptoms can last days, weeks, and months. No 2 concussions are alike. My colleague coins concussions as a snowflake because every single one has to be treated on a case-by-case basis. You can have 2 identical individuals, same height, same weight, take the same intensity hit. One recovers in 2 weeks, one recovers in 2 months. Why that's the case to date, we're trying to figure that out in research, but to date we don't know why that's happening. And that's why we have to treat it on a case-by-case basis. There is no treatment for concussion other than physical and cognitive rest. At least initially after impact, it is imperative that that individual, at least for a couple of days, has physical and mental rest, and then slowly do some active rehab and slow activity to see how they feel. If signs and symptoms appear, you have to tone it down and regress back. Signs and symptoms range from physical, such as headaches, nausea, dizziness, sensitivity to light and noise, emotional and behavioral, frustration, anger, sadness, irritability. sleeping too much, sleeping too little, and mental fogginess, feeling slowed down, difficulty concentrating. You don't have to have all these signs and symptoms. You can just have a couple to be diagnosed with a concussion. But those are the key ones to really watch out for when you suspect a concussion in a player. This is a fact sheet we developed and put together, but really it's to show you that in 2010, $2.4 million was spent on hospitalizations alone for concussion treatment in BC. Now that was 5 years ago, and over that 5-year period, concussions have really piqued attention, and the numbers have gone up in the emergency departments and physicians' offices. That's not to say that more concussions are happening. I think that's an awareness issue, and more parents are taking their kids to get medical assessment. So that's a gross underestimation, and I have no doubt that we're probably sitting at 5, 6, 7 million right now. So in the sport of hockey, we really need a culture change. Players are getting bigger, faster, stronger. You know, during a Canucks game, if there's a fight, half the stands are on their feet cheering, and so are the kids. And kids learn by example. So we really need to have a culture change. And I know BC Hockey is working with Trevor Linden on sportsmanship in the stands. So that's fantastic, because we really want to set a good example for our children and youth. Mental health is an emerging key problem that we're hearing more and more about. We've had the deaths of numerous NHL players, suicides, most recently Todd Ewan, and all these individuals were enforcers in the league who clocked thousands of hours of head contact. And this repeated head trauma caused changes in the demeanor and mannerisms of these players, ranging from anger, depression, anxiety, and none of them could explain what they were going through. It's an invisible epidemic. We're dealing with it with young children. We have a 12-year-old elite soccer player who sustained a concussion. Type A personality, very high-level elite player, sustains a concussion. He's now taken out of the sport he loves playing. He's taken out of the school setting. He can't function normally on a day-to-day basis because the signs and symptoms are ongoing. And he's going through anxiety and depression at age 12 because he doesn't understand what's going on with him. So we really need to heed the warnings and work with these children and youth to assist them in recovering from the concussion. Similarly, you've heard in the NHL, there was the NHL class action lawsuit, but all these retired players were exhibiting similar signs and symptoms such as depression, changes in behavior, memory loss, personality changes. And all of this has given rise to a body of research known as chronic traumatic encephalopathy. The Boston University has the Center for the Study of Traumatic Encephalopathy, and the Cranbrook Neurosciences Institute back east in Ontario has it as well. And what they're doing is they're autopsying the brains of deceased professional and non-professional athletes, as young as a 17-year-old high school player and as old as an 80-year-old boxer. And what they're finding is that there is something called a tau protein. Now, tau protein is present in elderly dementia and Alzheimer patients, but they're seeing this tau protein start in these young athletes. So something is catalyzing this chain reaction to cause an accumulation of tau protein in the brain, which then resembles early onset Alzheimer and dementia symptoms. So the image you see there on the left, you've got a normal cross and microscopic section of the brain. The middle is a very famous deceased NFL football player, and you can see the brown speckling in the cross and microscopic sections of the brain, so prominent in this 45-year-old NFL player. And on the far right, you see really marked concentration of tau protein, and that's in an 80-year-old boxer. So chronic traumatic encephalopathy is a progressive degenerative disease. The interesting thing is it does not appear in all autopsied brains. It appears in 87, they're quantifying it by saying it appears in 87% of the brains autopsied. So the interesting thing is, what gives rise to catalyze this chain reaction occurring? Is it the intensity of the hits to a certain part of the brain? Is it the number of hits that occur to the brain? And that's what they're trying to figure out. And CTE, or chronic traumatic encephalopathy, is staged based on the concentration of tau protein that is present in the brain. So we have a long way to go in science to understand why these individuals who have this tau protein have it. You know, what started this chain reaction from occurring. We often get questions about soccer. Should young kids be heading the ball? And there's no policy for that currently, but our suggestion is kids under the age of 13 should not be heading the ball, simply because they don't have the neck and shoulder and musculature developed to be able to do the technique correctly, and their brains are still developing. So essentially what you're supposed to be doing when you're hitting the ball is tightening your shoulder and neck and leaning into the ball. What these younger kids are doing is basically standing there and letting it hit their heads, creating basically a bobblehead effect. But a most recent study that just came out over the summer showed that it wasn't ball contact that gives rise to the high number of concussions in soccer. It's really player-to-player contact, and that's primarily in the higher-level elite athletes that they looked at. So that's an interesting finding as well. But studies in soccer are very preliminary, and there need to be longitudinal, longer-term studies to really understand what's happening in soccer players. So in the United States, I'll let you watch this clip here and watch the little arrow there. So Zachary Lystedt took that fall, and it isn't seem too much of a fall. Here it is in slow motion. You know, it seems pretty harmless. But essentially, Zachary took that fall. He came off, the trainer assessed him. He went back in and played and completed the game, and came off after the game and said to his dad, "Dad, I can't see," and collapsed and was in a coma for 10 months and was told he would never walk and talk again. His dad said, "I do not want this to happen to anybody's family or any child, and we need to do something about it." This gave rise to the Lystedt Law, which is now in every state in the United States. The Lystedt Law states that prior to the start of season, every coach and parent has to take preseason concussion education and sign a consent that they've received that education. During a game, if there is a suspected concussion, that player is to be removed immediately from the game and not allowed to return to the game unless cleared by a licensed healthcare professional. And I think that is very valuable, and I think we're moving towards this somewhat here in Canada. Similarly, we have the Rowan Stringer inquest, which Rowan Stringer was a rugby player who sustained 3 concussions in the course of 1 week. She did not tell anybody about it, primarily her parents. She was not feeling right. She had headaches. She was feeling off. She mentioned it to a few of her friends, but her friends didn't think much of it. And she went in and played in that 3rd game where she collapsed and died. So again, this just gives a test to the fact that we need to recognize it right away. Something needs to be done, and that individual has to be removed from play. So having said all that, whose responsibility is it? Whose responsibility is a concussion? Well, it's not just one person's responsibility, it's everybody's responsibility, from the individual themselves to the players, coaches, referees, trainers, and school professionals. We really need a top-up approach and a bottom-down approach to raise the level of awareness and understanding in this field. So in terms of an individual responsibility, they are the best advocates for their health. If they are not feeling right, they need to tell somebody, and they need to know the importance of telling somebody. A lot of times, players want to be heroes to their teammates, to their coaches, to their parents, and they really need to understand that the importance of being honest with themselves and telling someone if they're not feeling right. There was a study done in the U.S., and what they reported was that out of all the players that were polled in a survey, 56% of those players said they would hide symptoms to stay in the game. And we really want to change that statistic because it's really detrimental to the health of these players. There are more than 300,000 sport-related concussions every year, and that amounts to more than 30 concussions every hour. It's the parents' responsibility to really listen to their kids and not push their kids, and know how to respond. I tell the story quite frequently of a hockey game I went to. My daughter plays with the boys, and she was just in the changing room getting dressed, and there was a game going on. And apparently there was a scout in the stands. And this one young fellow, Pee-wee level, Pee-wee or Bantam, I can't remember. Sorry, I think it was Bantam. Took a hit. He was noticeably shaken up. He had to be helped off the ice. The coach did the right thing and didn't play him, but not more than 10 minutes later, that parent of that child was on the bench yelling at that coach to put his son back on the ice. And it's that kind of behavior we want to get away from, just to give parents the tools to really understand the harm they could be doing to their children by not recognizing that something could be wrong. A lot of times, here in the Lower Mainland, we're on the seawall, and we'll see children biking, but parents not wearing, and children wearing helmets and parents not wearing helmets. Again, it's very simple. Or we'll see, kids with their straps undone or their helmets backwards or too big. It's really imperative that if we're going to take that extra effort to be preventative by having a helmet, we wear a correct size helmet, and we follow the 2V1 rule, 2 fingers above the eyebrows, the V, the straps of the bike helmet fit like a V over the ears, and 1 finger length space between the chin and chin strap. And parents have to set a good example to their kids, because at what point is that child going to say, "You don't wear a helmet, why should I?" It's the coach's responsibility to know how to respond to a concussion, recognize that one of their players may have been injured, know what to do, who to tell, and when to allow that person to return back into play. Another example I can give you is a coach recently said to me, "It's not the safety of my players that's my responsibility. It's my responsibility to put out a winning team." And it's that, again, attitude that we want to get away from and change. It's the trainer's responsibility to know how to recognize and diagnose a potential concussion. It should not happen at the bench. The individual should be taken into the locker room or a quiet area and assessed accordingly. It's the referee's responsibility to control the game, because if they don't control the game, it just makes the game worse, and there's cheap shots that take place. It's the medical professional's responsibility to accurately know how to diagnose and treat a concussion and give the correct guidance to individuals on how to recover from a concussion. The old treatment protocol was go home, wake the patient up every 2 hours, ask them a few questions, and let them sleep. That's not the current protocol anymore. That was the old school philosophy. Now you let the individual sleep through the night. You monitor them for normal breathing, nothing untoward, again, regular breathing pattern, no skin color change, but you let them sleep, because every time you wake them up, you're essentially firing up the brain and you're not allowing it to rest. And lastly, it's the school professional's responsibility to know how to integrate a child back into the school system should they have sustained a concussion, how to modify their work course load, and also how to respond to a student who may have potentially sustained a concussion in the school setting, and what policies are in place for that. So it's really everyone's responsibility. So recognizing that, I would get calls in my office all the time from parents saying, "Oh, well, I took my kid to the Emerge. The doctor said he's had a bump to the head. Go home. He'll be great in a couple of days." Or, the coach didn't tell me that he took a hit during the hockey game, and I let him play the next day, and he took another hit, and now he's sidelined indefinitely. How come nobody told me? Where do I go? What do I do? So we quickly recognized there was a disconnect, and we needed to do something about it. So we did an environmental scan to see what existed, and the handful of tools that existed out there had limitations. They were essentially a slide deck. There was a cost attached to it, and our government said, if I want British Columbians to know about concussions and be aware, why would I charge them? So we want to build a one-of-a-kind resource that doesn't exist, encompassing different components. In focus groups that we conducted, We recognize that people learn by different modalities. Some like to listen, some like to read, and some like to watch. So we built all those components into the tool. We wanted it to be applicable provincial, national, and international, because how you diagnose a concussion here should be no different than how you do it in Ontario or anywhere else. We wanted it to have credibility with online experts, interviews with experts in the field, and we wanted individuals to get something out of it. So physicians can claim continuing medical education credits for it, and parents and coaches and school professionals get certification upon completion. We wanted it to be evidence-based, based on the latest up-to-date information on concussion in terms of recognizing, diagnosing, treating, and managing concussions. So basically, we wanted it to have different components. We wanted it to have the online training component, or the online course. The parent and coach course is roughly about 31 minutes in length. The physician's course is 42 minutes in length, because we heard that from physicians is we want the most amount of information that we need in the least amount of time. So for these online components, we put all the pertinent information pieces into it. And another key feature we heard was that I don't have a lot of time, so I want to be able to watch it in smaller chunks. So if you take, say, 10 minutes of the course and you leave and you come back, you can start where you left off. You don't have to redo the whole course. We wanted it to have quick and easy access to guidelines and information. We wanted it to have resources broken down by sections. If you Google concussions, you're going to get millions of hits. How do you know what's the most credible resource out there versus a blog that someone has written? So we've sifted through that and done all that work for you. We didn't want to reinvent the wheel because there are credible websites out there, so we just provide those links on the site as well. And we've developed printable resources for individuals, for physicians, for parents, and some of which are smartphone accessible, and I'll talk about that quickly in a minute. So how is the CAT, the Concussion Awareness Training Tool, unique? It's based on the learner-centered model of reading, watching, and listening. It's free of charge. It's updated and reviewed every 2 weeks. Concussions are an evolving science, and new and important information is coming out on a daily basis. So whatever is applicable to the audience, we will upload that onto the site, and we also monitor it for broken links and fix anything that's not working. It's available 24/7. It's evidence-based. The tools that have been released have been evaluated because we wanted to show value in having it and that we weren't just spending money needlessly. And we're constantly making enhancements to keep it current. So if you go to CAT Online, cattonline.com, you'll get this homepage interface. And depending on what lens you bring to it, you can click the according button, and that'll take you to the site. So I'll just walk you through some of the pages really quickly. This is the medical professional site. As you can see, we built it with an ease of navigation. It's got the Learn component. We built in the Sport Concussion Assessment tool, the SCAP3. So physicians in office can do it online and fill in the parameters and print it out and put it in their patient file, as well as having the resource section as well. We did evaluate this tool to look for changes in attitudes, knowledge, and practices amongst physicians and nurses. And what we found is that for those physicians who took the online training, it changed the way they practiced in a clinical setting. And that's really the key highlight. That's what we wanted to see, is that physicians were up to date and wanted to know how to recognize and diagnose a concussion accordingly. Similarly, for nurses who took the training, it changed their practices and attitudes as well. And again, exactly what we wanted to see. We rolled this tool out in the summer of 2013, and as you can see, it's received worldwide reach. And the uptake of the site has been pretty consistent on a day-to-day basis. We get about 50 to 75 hits per day. And to date, when I looked at the numbers this morning, we had about 60,000 views from around the world, which is fantastic. The second tool we rolled out last summer for parents, players, and coaches, again with a similar look and feel as the medical professional tool. Again, players need to understand what a concussion is and how it occurs. They need to understand what the symptoms are and the importance of acknowledging a potential concussion. Parents are central to the management of their child's concussion recovery, monitoring their child on a day-to-day basis and seeking medical attention, and ensuring their child follows their recommended treatment protocol. And coaches, and this course is primarily for the volunteer coach in minor associations, not the high-level elite coach who has to take higher-level training such as the Coaching Association of Canada. They need to know the principles of concussion management, They need to be knowledgeable, especially in high-risk activities. They need to be able to, where possible, compile pre-participation information such as previous history of a concussion, long-term recovery, etc., and need to take appropriate action when a player sustains an injury that could cause a concussion. So this is the online training module for coaches and parents. We didn't develop one for players because we didn't think that players would sit and watch, especially the younger children, sit and watch a course for half an hour. So what we did was a lot of our colleagues have done really good, poignant YouTube clips. So we've added that to the site instead. So depending on what lens you bring to it, whether you're a coach or a parent, you can take the online training module. We've got the sections of common questions as well as red flag symptoms, which is broken down into sections themselves. And these are the YouTube clips that I was talking about for players to watch, which are very poignant, some of which are some individuals who are going through a concussion or have gone through a concussion talking about how they were feeling and what they did for their recovery process. And we've developed tools such as the concussion response tool and the questions to ask your doctor. So these two tools are smartphone accessible. You can pull them up on your smartphone if you're at a hockey game and fill in the necessary parameters and email it to yourself and be able to print it and take it to your doctor. The questions to ask your doctor we developed because we constantly got calls in the office saying, I forgot to ask this, I forgot to ask that, what do I do? So we thought if we develop a one-page question sheet, that would be really beneficial for parents as well. So when a child is removed from play, they should adhere to a 6-step return to play protocol. Step 1 being no sporting activity, stage 6 being back in the game, and incremental increases between them. So we've redesigned this to make it more palatable to a parent to understand what they should be doing during each stage and when to regress back. Similarly, we've redesigned the return to learn protocol, similar to the 6-stage return to play, again, with what the child should or shouldn't be doing. And I do want to stress that return to play should come before return to learn should come before return to play, because academics should come well before returning to sporting activities. So we've designed these to make it more understandable for the parent. Again, we evaluated this tool when we launched it to look for changes in attitudes and knowledge, and what we found is that for those parents and coaches who took the online training, it changed their knowledge and understanding in terms of recognizing and knowing what to do. This, again, we launched last summer, and as of this morning has received worldwide reach with about 16,000 views from around the world. Lastly, we will be launching the School Professionals tool. We're a little behind, but hopefully this will be released by the end of November, early December. Again, a similar look and feel. And what it's going to do is address how to recognize the signs and symptoms, how to respond, to understand what a student needs to recover, prepare for a student's return to school, support a student's return, and how to prevent and support practice through strategies and policies within the school setting. Just a few other points. We've done extensive knowledge translation on the CAT, so these posters and signs and cards sit in physicians' offices, emergency departments, rinks, soccer pitches, etc., and are available if anybody wants any. And we are constantly making enhancements to the site. Again, we're going to really expand on the mental health issue. We're translating it into other languages, such as French, Punjabi, and Cantonese. We're going to add supplements to the medical professional site in terms of how to address mood changes, sleep hygiene, headaches. And we've had numerous requests for an app development, but I'm not sure we need that at this point because the CAT is still accessible on your smartphone. So we need to do a bit of an environmental scan to see what exists out there currently and what we could do. Just really quickly, what else is happening in our province? Football BC has mandated the CAT prior to the start of the season this past September. So all coaches had to have completed the online training. Hockey BC, as you all know, we had the banning of body checking at the Pee-wee level. We're currently collecting data to look at the need, whether there needs to be a ban at the bantam level as well for rep players and throughout Canada as well. Some house leagues still have it at the bantam level. And Hockey BC, again, has been instrumental, with other activities such as sportsmanship in the stands. We're working with Trevor Linden to film a 15-second PSA that will air on global television that just basically states that if you think only pro athletes get a concussion, have a word with yourself, and a second one that says a concussion is a brain injury and needs to be taken seriously. We had the concussion tool highlighted heavily at the Northern Health Canada Winter Games, and I just received an email last week that the Northwest Territories are mandating it for their coaches as well. We've got social marketing campaigns that are happening throughout the Lower Mainland. These signs are going to be in, and some of you may have seen them at ice hockey rinks throughout. They're going up, and we're going to have PSAs on global television. Other than Trevor Linden, we're going to have Bobby Leonarduzzi and Angus Reid as well speaking to the issue. So, in a nutshell, it's a really complex and multifaceted injury. What I just spoke about is just one piece of the puzzle. It's the education piece. But there's also the enforcement piece and policy. There's engineering and technology. Everyone is coming out of the woodwork to make a buck on concussion. You've got, all these different helmet manufacturers coming up with what they're coining as concussion-proof helmets. There's no such thing as a concussion-proof helmet. You're still going to get the mechanism of the brain bouncing around inside the skull. I know Bauer React helmet, they touted their helmet as a concussion-proof helmet, and now they have a lawsuit against them because a father is suing because his son sustained a concussion. So just keep that in mind. There's no such thing as a concussion-proof helmet. So in conclusion, what's needed is astute detection, accurate diagnosis, optimal management, and appropriate follow-up. And I like to use this quote that my colleague coined at our last concussion consensus meeting, who said that we know so much, yet so little. We are at the end of the beginning. Where we've come in the last 5-7 years is enormous. We've learned so much, but really, what do we know? Not a heck of a lot. There's not a real conclusive way to diagnose a concussion. Concussion signs and symptoms can mirror other ailments. Why does the tau protein happen in some athletes and not others? We definitely have a long way to go in understanding this field, but I think in the next 5-10 years we'll make enormous strides in getting there. Thank you.
Awesome. Thank you, Shalina. Bill, do you have anything to add?
Anyone does have comments or questions that we could forward to Shalina, you can certainly do so through the BC Hockey emails. Probably the best one is info, at bchockey.net. And we will make sure that someone gets back to you with a response. And if in fact that there is enough interest to run a question and answer webinar, then we will book one and carry on from here with your questions and answers from the experts. So if you could do that, that would be great. And then we will use Shalina and the rest of the Safety Risk Management Committee and people to respond to your questions on the topic.